Like, what are some things that you would tell students to prepare for this transition to being now a leader in a hospital?
My first reaction is going to say, like, it's going to be okay.
I know.
Like, because I think when you come out, you're like all this excitement and it's so exciting. And to not lose that joy or that excitement and to remind yourself that this is the job, like this was your dream job. Like you're doing it. Be so proud of yourself.
Yes.
Like, and if you were trying your best, like that is the great, like continue to try your best, wake up, do your best. And best looks different on each day. And so I think my advice would be just that like, don't lose that joy. Don't lose that passion.
Hi, everyone, and welcome to Season 1 of the Veterinary Leader podcast, brought to you by Companion Pet Partners. I'm your host, Dr. Kate Eldon, and I'm so glad you're here. At Companion, we're passionate about growing leaders, and that's what this podcast is all about. Whether you're an associate veterinarian leading your team in a busy hospital, a practice owner or medical director leading a large, diverse team, or maybe you're in industry, policy, or operations, this podcast is for you. You're going to hear real conversations with leaders across our industry who are shaping the future of veterinary care. Our hope is that these conversations challenge and inspire you in your role as a veterinary professional. Now, before we get started, I want to ask you a big favor. Please take a moment to like and subscribe to this podcast. It's a really simple way to let us know you want to hear more of these conversations, and it'll help us reach more people. All right, are you ready? Let's dive in. Hello and welcome to this week's episode of the Veterinary Leader podcast. I am so excited for this conversation today. We are going to blow up this idea that leadership is a title. And my guest here with me today is Dr. Brittany Boitnott. Brittany, welcome.
Hi, thank you. Thank you so much for having me.
Thanks for being here. I'd love to introduce you to our audience by reading your bio.
Okay.
You grew up on a dairy farm in southwestern Virginia where you discovered your love for animals. You attended Virginia Tech for your undergrad degree in dairy science and later made the switch to our smaller furry friends. You graduated from Virginia Maryland College of Veterinary Medicine in 2023 to pursue a career in small animal medicine. You have a love for integrative veterinary medicine and attended the Chi University where you were trained in veterinary acupuncture. You love being outdoors, yoga, paddleboarding, and spending time with your pets and partner. And I'm also excited to get to talk to you because you are a fellow companion doctor and working at Center Veterinary Clinic here in San Diego.
Yeah.
Is there anything else I missed that you want to add?
I don't think so. I think that covers it. It's like so interesting hearing it all laid out like that. You're like, oh, this is me.
I know. You just graduated a couple of years ago and look at all the things you've already accomplished.
Thank you. I so appreciate that.
And that's like, that is one of the things that I want to talk about today is this idea of you go through vet school. People are telling you what to do. You don't really get to make your own decisions. And then all of a sudden, now you're a veterinarian in a hospital, you're leading a team, you are a leader by definition. What was that transition like for you, like the first few days?
So I think for me personally, the first few days, which I'm very lucky to have really great mentors, I was shadowing my medical director, which is Dr. Bigelow. I was shadowing him for the first few weeks, which was really helpful to kind of like still feel like you had a little bit of like kind of the structure there. I kind of equate it to like learning to ride a bike, but you have the training wheels on in vet school. Like you're very much like, it's like the structure of like, I can suggest things to the leading veterinarian. But I think for me, the biggest thing was like, when you become a vet, it's like the training wheels are off. And it's like, you're riding the bike, you are just going and you're making your own decisions very much. And so I think that was kind of the biggest transition in the first few days of me working as a vet was learning like, oh my gosh, I make the decisions. Like I am like, it's real. It's like reality kind of setting in that you're the veterinarian and it's like been your dream and you're officially here. So I think that's kind of my first few days was a little bit about kind of what was going on in my head and kind of what I was doing.
I can relate to that. It's more of it's a feeling, you know, we remember how we feel in that moment of, oh my gosh, now I'm the one making the decision.
Exactly.
Right?
Yeah.
Is there anything that you wish, like a skill that you wish you had gotten in your time at school that you didn't get that would have helped you when you started out in practice?
Yeah, that's a really good point. So I think for me, we did have a class. So in my school, it was really great. It was kind of like not a traditional sense of how they did. The classes and stuff was a little bit different, but we had a class called Becoming a Professional. And I feel like when we had that class, you're kind of like, oh gosh, I got to go to this class. Like and I wish I would have focused a little bit more and wish I would have kind of had a little bit more of like an interest in that, simply because I think like you said, you're thrusted into this leadership role where you're leading people and you're essentially a manager. People are looking up to you. And it's like you all of a sudden have to kind of figure out how you're going to do this. So I think being that more of a leadership skill, or having more of that leadership skill and focusing more on that, I think would have been important, because I would argue that's almost just as important as like your clinical skills, right? Because your communication with people, how you interact with people, all of that is so important. So I kind of wish I would have focused a little bit more on that and paid a little bit more attention in that class instead of just being like, oh, I only want to learn about because the clinical stuff is important, but I think the leadership skills are just as important.
Totally. I can relate to that too, thinking back on like the law and ethics and business classes and things that I was like, oh no, I need to get my anatomy and physiology down. But absolutely, like we had a clinical skills training class that a lot of us, didn't see the value until we were out.
Yeah.
I can relate to that as well. How has the reality of practicing veterinary medicine differed from the expectations that you had when you were in vet school?
That's a really good question. I think for me, I have always been pretty good at communicating with people, but I think the biggest kind of expectation is I thought you kind of have this assumption that like everybody's going to be the same and like you can kind of practice medicine the same way. But then when you get out, you kind of realize there's different owners and different clients that you're kind of working with and kind of adjusting the way you even speak. Like the way I speak to one client might be different than the way I speak to another client. So I would say that kind of was like an expectation I had, is like, oh, I'll just be the same with everyone. And it's not that I'm changing my personality, but I'm just learning to communicate in different ways with different people, because some people respond better to different things. It's almost in some ways I don't want to say you're a therapist, but you're kind of trying to figure that out and figure out how I can get this information across the best way to owners, because some owners respond different to different things than other owners. So I would say that was kind of an expectation I didn't really have. And that's more of the reality that I had when I kind of stepped into that.
I'm seeing this kind of common thread here, and the idea that veterinary medicine is so much about people and the person-to-person communication. And I think a lot of people outside the profession think about is the focus is on animals, and you go, or you get into veterinary medicine because you love the animals, and then you come out of veterinary medicine and you really have to lean into the people. And I'm seeing and hearing that in what you're saying as well.
I would agree, yeah.
One thing that some people may be interested in and others may not, but you have chosen to focus on is this integrative veterinary medicine where you did acupuncture training. Tell us about that.
Yeah, so I actually did it when I was in vet school. We had with the Chi Institute, they do it when you're either in your third or fourth year of vet school. So I did it when I was in my fourth year. So integrative medicine, I think, is a side of medicine that we don't really touch into as much, because it has a lot of like things that could go along with our traditional sense of medicine. So I attended Chi University for just my acupuncture, but it's been really great to use that in combination with my Western, what you would say, so like Western and Eastern medicine, using them in combination, and seeing how well that helps patients, especially like your arthritis patients or your IBD patients or all of those patients that are responding to acupuncture, while also simultaneously using medicines and more Western things as well. And I think it's a side of medicine that we need to kind of like lean into a little bit more in the veterinary world, because it certainly is really helpful.
I really appreciate that as well. I did acupuncture training at Colorado State my fourth year, and I was practicing on horses at the time. But this sense of looking at the animal and seeing a holistic sense and interconnected, because this day and age we have so many specialties and things get siloed to the ophthalmologist and the neurologist, but we as general practitioners, one thing that we can really do is step back and really look holistically at the animal. And acupuncture, the whole training, Eastern medicine really focuses on that. And it's a partnership with everything else that we do. I agree, like you said. Can you think of a specific case that really stood out where you've done acupuncture on? Can you share that with us?
That's hard. Yeah, I think I've had so many different ones, but I think my most rewarding ones have probably been my arthritis ones or my like degenerative myelopathy ones, and seeing these patients come in. Like I had one in particular where this dog was just super painful, not wanting to walk. He had some neck issues going on, and I did one session of acupuncture, and the owner was like, when he came back to me, he was like walking with his head high, and he was happy for the rest of the day. And he's been like that since. And so I've had so many instances of that where people are like, I'm not having to give the medications anymore. Like I'm not having to give carprofen or Rimadyl or something like every single day like I used to. Like they're moving better. And what is most rewarding to me is not necessarily the mobility. Obviously that's important, but hearing them say, oh my gosh, they picked up their ball and they wanted me to throw the ball for the first time in years. And it's like, you're giving that dog that joy back, which is so rewarding to me, and giving the owner the joy back too. Because like we said, owners are, it's like you're dealing with people, but you're also dealing with the patient. But it's like being able to help both of them have a better kind of client, like owner patient relationship. So like a human animal bond. You're improving that as well, which is really important for me. And so, because I love my own pets very much. So
I love that too. And that's such like the best job satisfaction when you see you make a difference in the pet's life, and then you see the difference that waterfalls down to the whole family's life. You know, we're so connected to our pets. And it was just Human Animal Bond Day this last week. And so I love that you brought that up. That's, I mean, that's part of all of our whys we got into this profession, right?
Exactly. Yeah.
So thanks for sharing that.
No worries.
Let's talk a little bit about mentorship.
Yeah.
And so tell me about, what was your mentorship experience like coming out of vet school into Center?
So I had a really great mentor, Dr. Bigelow. He was really amazing. Really what I kind of equated to, going back to the analogy that I used of like the training wheels, and like when you go out of vet school, the training wheels are off the bike and you're riding the bike alone. I feel like your mentors are the people that come beside you and like are like pushing you like, you got it, like go. So my mentorship experience, especially with Companion, they have that mentor program that's super helpful. So I was having like weekly meetings. I also was in a multi-doctor practice. So not only did I have my main mentor, but a variety of different older veterinarians that could like put input in and answer my questions. But the weekly meetings really helped. And what I appreciated about my mentorship program is it wasn't only on like the clinical skills, but it was also on like mentally, like, how are you doing? Like, what is going on? And I think Francesca, who works with Companion, had that weekly meeting where it was like coming in and saying like, hey, how is it going? Because I think when you come out of veterinary medicine or veterinary school and go into veterinary medicine, it can be really scary. You're like kind of thrusted and they're like that. You dive into the deep end of the pool and it can feel a little lost. And so I appreciated that mental health aspect was in there as well, to kind of reassure you and give you a supportive structure to say like, hey, this was really hard. Like this client got angry at me and that was really upsetting. And having that ability to talk about that in the weekly meetings as well was really nice.
Yeah. Francesca, our licensed social worker, I mean, she has experience in working in veterinary schools and veterinary hospitals, and she really understands that this like, the emotional component, the soft skills of being a veterinarian, how, I mean, that part is just as important as the clinical skills, because the people are the gateway to our pets, right? So I love that you called that out. Was that something that you were looking for when you were coming out of vet school? Was that mentorship program? Like, what were the things that you were looking for when you graduated to find where you were going to land?
Yeah, for me, I was looking for strong mentorship was really important to me, because I wanted to have someone there that I felt like I always use the joke with Bigelow, like, well, you raised me, like, because it's essentially what's kind of occurring is like you are getting trained and those like skills are being implemented in you, and those client communications are being implemented. Those leadership skills are being implemented in you. So I was looking for a strong mentorship. Another important aspect was having a really fun team and like happy team to work with that was very supportive of each other. I'm very lucky at Center Veterinary Clinic. I love my team. We're very supportive of each other. It's very much a family feel, which I really appreciate. And I also wanted a hospital and a company as a whole that I feel would really invest. I've always had the desire for more knowledge. And so I feel like Companion and Center Veterinary Clinic both are always like, you want to go learn that? Go learn that. Like that would be so cool. And I think that is what I really appreciated. So that's kind of what made me lead to go to Center Veterinary Clinic, was just being on the cutting edge of things and being able to try new things and having people support me behind that.
100%. Our journey as veterinarians is just this like, back and forth between, student and leadership. And we are always learning, right? I hope that as a veterinarian, I continue to learn forever, right? But also then growing into leading and leading with that new knowledge that you get. You guys have a endoscopy at Center as well. And did you get training in endoscopy, otoscopy, stuff like that at school?
No. Like, I think I watched maybe 1 or 2 endoscopies. It just wasn't really something that was necessarily like taught to us. I mean, it was taught, but it wasn't like a core area, which I think it's mainly was like, oh, this is a specialist thing, but getting to learn it for myself and see the benefits of, obviously specialists are really important. We have that place, but being able to provide care at a general practice in those emergency situations or at a lower cost with the endoscopy, otoscopy, all of that has been really great.
Yeah, that's another tool that you're getting to learn on the job as well too. How are you continuing to learn and grow now that you're a couple years out of vet school? Is there something that you're doing specifically to go out and seek more education?
Yeah, I think kind of what you touched on earlier in veterinary medicine, I think a good doctor is always going to be someone that knows they have more to learn and that they have more. There's never a ceiling for like, I have reached it. I am the epitome of a great doctor. Like there's always going to be that like push to be a little bit more better and to learn a little bit more. So I think for me, learning has been finding something I'm interested in and looking into CE in it and seeing like just cases throughout the day or throughout the months and seeing where I'm noticing some weaknesses that I have, or like, it would be really cool if I could bring this would really help my patients. So for me personally right now, it's like we do urgent care at Center Veterinary Clinic. So I'm like, what would be really helpful if I knew better how to do an abdominal fast scan and a TFAST? That would be so helpful because it would really help me in these cases, because I want to be able to help these owners, get them more answers, help that human animal bond. And so I'm like, that's what I want to do next. So I think it's like setting these goals for yourself and seeing where you can have improvement and seeing like, hey, I could improve this. Or for me, noticing, hey, sometimes with my client communication, I could be better. I could explain things more. So maybe there's so much free CE out there, doing CE on like, I've done one, like sometimes I'll just do a free CE, like an hour of like client communication or like how to say bad news or something like that. Cause there's all these different types of things that you can learn and tidbits that you can get from people that can be so helpful that you can implement into your practice.
I love that. And I love that is it just that you sit there and wait for things to come your way, or are you actively like going out and looking for opportunities that you can,
I think I have a blessing and a curse. I'm a perfectionist.
So
I think I'm always thinking of ways that I could improve upon things. And I think part as veterinarians, we're trained in our critical thinking skills. So I think having that training has helped me see areas. So I would say I'm probably actively seeking ways that I can improve and ways that I could better myself for my patients, because at the end of the day, that's what we care most about. And I know that's why all of us go into veterinary medicine, is because we want to help animals. We want to help people. And so seeing, for me personally, just like, hey, I want to be better at helping this person or better at helping this animal, and saying, how can I do that? And asking the hows, the whys, what can I do better, I think is really important. Those are questions that are always going through my mind.
I love that. Looking back on, you've been at Center for 2 years now, right? Thinking back on like the cases that you've seen and the interactions you've had at the clinic, are there any moments that really stand out for you in your first couple of years where either you had to step up and kind of like lead, and maybe there was a moment of discomfort or can you just share any highlights or lows?
Yeah, exactly right. Yeah. I think for me personally, it was dealing with clients and dealing with difficult clients, I think has been the hardest, because I think in veterinary medicine, it's just as important to be there for people, but also recognizing that those difficult clients are most often acting on a place of sadness or like anger for what's going on with their pets. So I think taking up a leadership of like essentially like trying to be there for those people and get to the nitty gritty of what's going on, but also supporting your staff as they're dealing with that. Because I totally recognize that sometimes clients can be really difficult and rude to our support staff. And then coming in and trying to support your support staff while also trying to help this person and figure out why are you like, what's going on in you? Because that kind of comes in where you're like, you're a veterinarian, but also sometimes you're a little bit of a therapist trying to figure out and work on and defuse the situation. Yeah. I think that's been the biggest thing for me, is figuring out how can I diffuse this and get this person to, I don't want to say calm down, because obviously it's a really difficult situation, but get this person to see that we care and we want to help them. And so I think instances like that, of course, I'm sure we all have our difficult client stories, but I think that's when I really had to step up and also stand up for my team, but also support the client as they're going through this.
Yeah. And I think that rings true. What I heard you say is like some standout moments from your first couple of years were less about the actual patients and more about the relationships between your clients and your teams, and how do you navigate this world where we're all moving in the same direction. We all really just want to help the pets, and just pausing to really realize that you guys all want the same things and have compassion for people and listen to them, but not take on their, someone who's really upset about their pet. You cannot take on all of their energy. You need to keep moving in the forward direction to treat the patient. Yeah. So, just one more shout out for really dealing with people and working with people is such a huge part of veterinary medicine. It's a huge part of leadership, and it's really the on-the-job training, right? That you get that makes a big difference. One question that I wanted to ask you is, do you have any advice for people that are coming out of vet school, that are students that are coming out of vet school? Like, what are some things that you would tell students to prepare for this transition to being now a leader in a hospital?
My first reaction is going to say, like, it's going to be okay.
I know.
Like, because I think when you come out, you're like all this excitement and it's so exciting. And to not lose that joy or that excitement, and to remind yourself that this is the job, like this was your dream job. Like you're doing it. Be so proud of yourself.
Yes.
Like, and if you were trying your best, like that is the great, like continue to try your best, wake up, do your best. And best looks different on each day. And so I think my advice would be just that like, don't lose that joy. Don't lose that passion. Because I've continually tried to cultivate that passion, that joy for helping animals, helping humans, helping both of them together and kind of further, like kind of helping the human animal bond. I keep coming back to that, but helping the human, I know, having a human animal bond, but don't lose that joy. Don't lose that passion. For me, I grew up like saying I wanted to change the world. Like I was like, I'm going to change the world. I was like so set on it when I was like 10. And then I realized that we have the goal, especially being healthcare providers or being veterinarians, to change individual lives for the better, like to change, whether that be a pet who's really sick or a human who loves their pet, this pet's their family. We get to change and make their lives better. And I think there's like a quote, I want to say it's Ernest Hemingway or something, that says like, if one life, and if it's not Ernest Hemingway and anyone's in the comments, like it's not, I apologize.
That's okay. It'll be our own fun discussion if it's not.
It'll say like, if one life it's like something along the lines, if one life is to breathe easier, that is a life well lived. And so trying to remind yourself of that.
Yeah, I used to tell myself this. I can even remember the mantra. I would say, like, if I help one pet today, it's a good day.
Yeah, exactly.
And I can remember in my early in my early years, just like having, reminding myself that, because we put so much pressure on ourselves, right? Exactly. I love that idea too of do your best, show up, be honest, do your best. We're all just doing our best. And then you can have a little bit more compassion for people when they're just having a bad day. Yeah. Right.
Yeah.
That's a really good takeaway.
Yeah.
I wanted to get to ask you too, what is your why, just going back a little bit, that brought you to vet med, and then kind of this transition from farm animal to small animal. Take us through your journey of that.
Yeah. So I grew up on a dairy farm. As you said, I grew up with cows. Cows will always be my first love.
Yes.
I love cows. It's the reason I wanted to go into veterinary medicine. When I was in vet school, I was a farm animal tracker for a little bit, but I decided probably in my second or third year that small animal medicine was something that I could just see myself more in. And so I made that transition over to that. My why behind getting into vet school was kind of simple. It was like, I want to help people and pets, which is why everyone's there, right?
Yeah.
But as I'm going into this more, and as I have gotten experiences being in my practice and dealing with, especially like euthanasias and like all those really hard moments, it's been being there for people and animals during those difficult times and providing joy when I can, or providing comfort when I can. I think as veterinarians, and I'm sure human doctors feel the same way, we have this unique ability to be there in very difficult moments. And it brings, I don't want to say joy, but it gives me a purpose to know that I'm there to ease suffering, and I'm there to help the human animal bond, and I'm there to be the best that I can be and provide comfort. And so I think that's kind of become a little bit more of my why behind why I want to do things. Because I know how much I love my pet and how much he means to me. And I know that other people feel that way. Like it is your family. It's a bond like no other. It's like we don't speak to our dogs, but it's like everyone knows what it's like to love a dog or a cat or whatever animal it may be, because they love so unconditionally. So it's like helping to support that and give that pet that comfort as well as the human.
Yeah. And you really are. When I was listening to you and I heard you, I'm like, well, Brittany, you really are changing the world and making it a better place.
Thank you.
Yeah. When you're there as a companion, as a medical companion with these families as they go through these hard situations. And you mentioned euthanasia, and I agree, euthanasia is really hard. And I also like to remove this kind of stigma that comes along with it, because sometimes it's like the worst and the best thing that we do. There's a lot of sometimes it's rewarding to be there for people in those last moments, right?
I think it's like it really is. And being there and seeing like what a joy it is to see that love being played out and to be part of that journey. It's, of course, like I form relationships being in general practice with these patients as well. And so knowing that at the end of the day, like you said, it's the worst and the best thing that we do. It's like the double-edged sword, but it's like getting to be part of that love and ease that suffering. And I always tell my owners, it's giving a dignified death, which is hard. It's a double-edged sword, but it's like nice. I don't want to say nice being there, but it's like, it's a privilege to be able to assist in that journey as well.
I'm just thinking about your role at Center Veterinary Hospital. So you came out as a new graduate and started straight there. And now this year, the year after, you had another new graduate that partnered with you. And this year, another one.
Yeah.
What is that like being in this environment where you are still, not that far out of school, and you're also are you mentoring and teaching? What is that kind of cohort like?
Yeah, so I think I definitely do mentor and teach sometimes. Like that is one thing that I do, but I think in a way it's nice because I'm so close to it. Like I'm so close to it, like seeing them come in and be like, oh man, this client's like so mad at me about this, and being able to be like, it's okay. Like this is like part of the job. It's a really sticky part of the job. But doing mentor and teaching. And I think for me, I've always had a passion for mental health. So I think for me, I tend to err more on like, obviously answering medical questions and saying like, hey, this is what I did, or like, this is what happened, but sharing those stories of like how I let certain instances affect my mental health, and being like, not to like say learn from my mistakes, but essentially learn from my mistakes, right?
Absolutely,
and like I'm like,
yeah.
and telling them like, I've messed up and this is where I've messed up and you can be better. So I think it's that's kind of all what it is about mentorship, is making that next generation better than you were, because that's the goal, right? Is to improve that. So a little bit of teaching, a little bit of mentorship. It is definitely interesting, because it's like, you're like, oh gosh, now am I also like I also am a new grad, but then, well, I guess I don't know when you not become a new grad, but
you're a couple years out. You don't have to be.
I know. So it's like being like seeing that, but also learning to step more into that leadership role. I think of like, okay, I'm a leader, and also like now they need my help as well, as fellow doctors.
I love that you talked about making yourself vulnerable and talking about mistakes that you've made, because I also think that's a really important part of leadership. If we don't come out and say, hey, I've made mistakes too, or just, you know, call out what they were, then how are people supposed to feel comfortable coming to us when they make a mistake? And that's so important from our teams on the floor. You know, if you have a technician that makes a mistake or gives the wrong dose or sends the wrong thing home, like you want to create a culture and environment where they can be honest about that. And
like I've had technicians make mistakes, right? And it's like every time when they come up to you and they say like, I messed up, like your heart drops a little bit, but instead of meeting them with like, I've never met them with anger. My first response has always been, that's okay, let's fix it. Yeah. Because I think that's the important aspect of it. And then
like, thank you for telling me.
Yeah, exactly. Like, thank you for telling me. And I find that most of the time owners, if you are honest with them and just like authentic about what happened, whatever it may be, and say, hey, this is what happened. This is how we're going to fix it. I think owners respond really well to that. And so I think that's a way to look at it. It's like the analogy of like a kid who spills like a glass of like milk or something, instead of yelling at them, being like, hey, let's clean this up. Like, let's fix our mistakes. Because I've certainly made the mistakes in my profession. And I know I will unfortunately continue to make mistakes. That's just part of it. But learning to be honest with the owners and try to be my best and learn from those mistakes and take those instances where I did mess up and say, this will make me a better doctor at the end of the day, for the future patients as well.
Yeah, I love that. So be honest.
Yeah.
Do your best, right? These are all really important skills or just values for all of us to have. Yeah, I love that. I'm thinking about always, how do we keep our profession fun? How do we keep the fun in veterinary medicine? Is there something that you do on a day-to-day basis or every once in a while to keep fun in your practice?
Yeah, I grew up with a brother who was very funny. And so I think in a family that's always been very funny and finding humor in things. So I think for us as a practice and things that I've done is trying to build those relationships and have fun like throughout the day of like doing little things that make you fun. Like for us this week, like we do things that remind us of like kind of tapping into that inner child. Like for Thanksgiving, we color little turkeys and we put them up on the wall of things we're thankful for. And so getting to read all those, I think for me personally, reminding myself that this is my dream job and I am so thankful and like just blessed to be a veterinarian. Like it's amazing that I get to do this. It's like I have to pinch myself sometimes because I'm like, this is so cool. Getting to remind myself of that happiness and joy is how I keep it fun. And being honest and authentic with owners and joking around is always, I mean, we all know that is always great. So I think that's how we kind of keep it fun.
Yeah, laughter is part of our health. It's so important. And I like what you said about like remembering this is our dream job.
Yeah.
You know, we worked so hard to get here. Like, let's step back and not let, you know, one thing that didn't go right just cloud that. Like, be excited about that.
Yeah.
Well, thank you so much for joining us today. It was wonderful having you on the VLP.
Thank you so much.
And I know you've got to go get to work. You've got patients that need you.
Thank you so much.
All right. Thank you for listening to this episode of the Veterinary Leader podcast. If you enjoyed this conversation, please like, subscribe, and share it with your network. This helps us reach more people. And thanks for being here. We'll see you next time.